Hi, my name is Clement. I'm a physical therapist here at Northern Rehab, and today I want to talk to you about a new type of therapy we've been offering called blood flow restriction training. Blood flow restriction training is an exercise adjunct that can help you make improvements in strength while using lower loads of resistance. Basically, this means an exercise that requires maybe to lift a 20-pound weight to fatigue out that muscle, we can accomplish a similar effect only using maybe a 5-pound weight, which by in turn can put less stress through a joint or strain on the tissue, which is important in populations that have poor joint integrity, such as arthritic joints, or people that have had recent surgeries or injuries where they can't really load that tissue or bear weight on a limb. We can improve strength with similar to using heavier loads. So we can accomplish this by taking a modified blood pressure cuff, and we'll put it around the limb that we're working with, and we pump it up to a pressure that includes the venous flow back to the heart, which by doing so, when we start to work a muscle, it forces the muscle to utilize oxygen and energy substrates faster, which by in turn creates more muscle recruitment and faster fatigue, which over time can lead to building strength and muscle mass. This type of training has been pretty well published over the years and is slowly growing in the rehab world as well as the fitness world, and it can be a nice benefit to a training program. So next I'm going to briefly demonstrate what the equipment for blood flow restriction looks like and how we use it. So we can use blood flow restriction either on the upper body or lower body, and we place the cuff either on the most proximal part of the arm or the thigh, depending on which limb we're working on. And we do that to ensure that we're not going to compress any of the vascular or nerves in the arm or the leg. We have several different size cuffs, depending on what size, if we're working with an arm or a leg, as well as the size of the person we're working with. Another thing we'll use for help improve the safety of this treatment is we take a Doppler ultrasound and we find what's called your limb occlusion pressure. So basically it's the amount of pressure it takes to cut off all the blood flow to a limb. To do so, we take the Doppler and we find your pulse either at your wrist or your ankle, and then we inflate the cuff up to the point that cuts off that pulse. And based on that, we can take a percentage of it and to know what safely pressure we can work at without compromising any of that tissue or tourniqueting your arm or leg. So I'll show you kind of what it looks like to strap one of these on. So I'll put it on my leg. So the cuff just goes around and we strap it on. And then it's going to look very similar to a blood pressure cuff. We have a little pump that hooks on, and we pump it up to whatever pressure that we found based on that limb occlusion pressure. So we get it up to a point there, and then this can disengage and allow me to perform whatever exercise we're going to do. So depending on what muscle we're trying to strengthen will depend on what exercise we'll have the patient perform. And then the protocol is set with a specific rep and set scheme to make sure that we're properly fatiguing the muscle and that we're going to get the right training effect by using blood flow restriction therapy. So that's the basic principles of kind of what it looks like and how we use it. If you have any questions or interest in blood flow restriction training, please consult a physical therapist here at Northern Rehab.